Hi, everyone. We are back. Welcome back to Face It with Dr. G. I'm Dr. G, and I'm so excited to be back with you guys. We had a little bit of a hiatus. There's been a couple things going on our end, and I hate making excuses, but it's true. I haven't had the time. So here we are, and I am so thrilled to talk about the lower face today. Specifically, a couple cases, one in particular, a case about discrepant aging of the lower face and the upper face. And what I think is interesting is, as I've been reading, doing some research, as we age, we don't appreciate negative emotions and animations as much as the positive emotions. So we somewhat lose touch with those negative emotions, the anger. As we age, those don't register as much in our brain. And this is called the positivity effect, where as we get wiser, we like to hear and respond more often and better to positivity, which we should all do, right? But the reality is that when we're younger, we focus more on negative emotions and topics. When we're older, we like the positive ones. And I thought that was interesting as I was reading. And I said to myself, well, if we're all positivity when we get older and we're thinking about how great our life is and everything we're doing, then don't we want to feel amazing on the inside and the outside and feel that we're doing the best we can for ourselves? So I thought that was interesting. And that's kind of why I love what I do, because we create beauty and it's all about your customized path of beauty, how you want that to look and how you want to look. So I had a case recently of a patient who came in, actually two of them, but I'm going to talk about one because they're very similar, who had very beautiful features, but very discrepant aging, specifically the clinical topical signs of aging in her skin health. She had some asymmetry of volume loss, which we all have as we age, a little bit more asymmetry and deflation on her right side versus her left. And she had some non-surgical injectables in the past, but still you could tell there were asymmetries. But what I noticed the most when she was speaking with me was the irregularities, the rhytids, the wrinkles, those two are different things, and we'll talk about those, around her lower face. And her upper face was beautiful, more smooth. She had overwhelming sun damage, but it was just apparent that her lower face had been through more trauma than her upper face. And I think this is why the consultation is so important and why I love it so much, because you're listening, but you're observing. You're observing how they talk to you, how they look at you, how they're holding their head. Do they have eye contact? Are they pursing their lips? Are they smiling? Are they frowning? All of these clinical signs and observations are so important to what you do for this patient in the long term. So she was talking to me and I could tell there were very exaggerated rhytids around her mouth. So rhytids are the more superficial lines that we experience. When patients have rhytids, you want to get them in to get those non-surgical injectables like Botox, Dysport, Xeomin, Jeuveau soon, right, if that's their goal. Those are rhytids, the more superficial lines. Wrinkles are the deeper, more advanced creases that we develop. And both of those are caused by, obviously, UV damage and other things. So that's what I wanted to talk about. What is my differential diagnosis of someone who, I haven't used that word in a long time. I love that. What is the differential diagnosis of someone who comes in that has discrepant aging of the upper face and the lower face? Are you guys thinking? So I have 4 different differential diagnoses, and maybe I'm missing something. I would love to hear from you guys if you have an idea. But I always ask them, and this is what's so interesting because, side note, they don't really ever tell you they don't give you this information. It's your job to figure it out because to them it doesn't seem important, Oh, they're concerned about the lines around their mouth or the creasing or the marionettes, the smile lines, the sagging jowls, but they don't really tell you what they've been through. That's your job. So my number one question is, have you ever smoked? And many patients say no, but some people say, yes, actually I did 25 years ago. My next, and obviously we know why smoking causes these fine lines and wrinkles and rhytids, right? So it's obviously that animation, that consistent and repetitive movement of smoking the cigarette, the pursing of the lips, and it's also that free radical damage to the collagen that's being created by the smoke. So you have double whammy, depletion of collagen, and by depletion of collagen, you get those lines that get deeper, and then you have the movement. So smoking is number one. Number two is, did you have acne as a child, and were you ever on Accutane? Patients that have a history of Accutane, and this isn't true across the board, but many of them have irregularities of skin texture and tone in their lower face, specifically if they've had acne in their lower face, after the use of Accutane. So it's this irregular modeling of the lower face around the chin, lateral chin, lower jawline that you can tell if someone's been using Accutane or did in the past. So that's my other question. And then my third question is, have you ever, or do you have atopic dermatitis? So do you have eczema? Do you have allergies? Have you ever had something called periorifical dermatitis or perioral dermatitis? And many patients say, yes, I have. How did you know? Because I don't have it right now. And patients that have had long-term irritation of their skin that have caused them to use usually high-dose corticosteroids on their lower face for an extended period of time, that can cause premature aging of that area. And if it's in the lower face, then they'll have premature aging of the lower face. I had a separate patient that had that specific situation where she had been using this high-dose corticosteroid for years. And it was so... first of all, she couldn't believe that I could tell and that I knew, and I asked the question. And, you know, she was so thankful and grateful that I was able to pick this up and that we could formulate a plan to get her to her goal. So have they been using high-dose corticosteroids? That's my third question. And then obviously the fourth obvious statement, which isn't always a question, is, you know, have you been using sunscreen your entire life? Seems cliche. If they have sun damage, it should pretty much be throughout their face and not localized to their lower face. But if they have very bad sun damage on their lower face, that can also lead to discordant aging. That's lower on my differential, again, because if they have severe sun damage, it should be more global and dispersed versus only in the lower face. So I hope this was super interesting to you guys. I encourage you, when you have patients, take in all of their information, but formulate a plan based on what you see after you ask them questions, and read a lot. Read about different dermatologic skin conditions and treatments that can lead to side effects, because we are experiencing those every day in our medical aesthetic practices, if we know it or not. And it's really important. That's why I like to talk to you guys about skin cancers and how to recognize them. Now a little bit of that, you know, the clinical derm of the lower face. So it's really important. I hope this was super helpful, short and sweet. Remember those four. The three are the most important, then the fourth, okay. Differential diagnoses for your patient that has discordant aging of the upper versus the lower face. I hope this was great, and I'm glad to be back, and I will see you guys again next time. And if you're in the Mashpee Commons area, we open tomorrow, September 20th. See you there.